Okay, this is the Ambu bag. We call it a BVM bag valve mask device. Okay. This one, you hook in. I'm almost out of oxygen, but you hook it in. This one, you flow at max possible on your regulator. So crank it all the way to 15. If it goes to 20, go crank it up to 20. Okay, the oxygen's going to come out of the tank, going to fill up the reservoir bag, and this will fill up. And every time you squeeze it, okay, you'll be delivering dang near 100% inspired oxygen. It's almost pure tank air. It entrains almost no room air into this when you get a good tight seal.
This is
now,
the band?
This is, you have to squeeze the bag. This is positive pressure ventilation. So in EMS, we use this when the patient's not breathing. They're not breathing for themselves, and I'm trained to use this, and this is a lot, I can deliver more oxygen to the patient with this device than I can mouth to mouth, okay?
Do you have to fill that bag completely with air like you did the other one? Or put air in it?
You start it up, you crank it up with air, yeah. In our skill set, what we do is we have, because the patient's not breathing, and normally it takes us a little bit of time to get there, we're interested in getting air, oxygen into the lungs as fast as possible. We're mobile medical, that kind of thing. And so we'll start out our skill set with room air only, just getting it on the patient. Of course, the pointy part goes on the nose, and ventilating for a certain amount of time, and then a second rescuer will come in and they'll get hooked up to the O2 tank. But that gets something on there as fast as possible. So you can use this without a tank, but you're only delivering what? 21%. Hook into a tank and it's almost 100. Okay, so this is hard. This takes skill, this takes practice. And the reason is getting a good tight seal. So disassemble this for a second. Some different techniques you can use is you can, of course, this pointy part goes on the bridge of the nose. You can kind of pull it apart, get it up onto the nose, lay it down, and push it down. Are you familiar with the CE clamp? Okay. So a good technique is to get the C part. This is the E part. Get the C part of my hand up around the neck of this mask. Okay, I'm gonna rotate around here. Get the C part up around the neck of this mask, and the E part, get it on the jawline of the patient, not in the soft part, but on the bone part. Okay, grab it and squeeze, but maintain a 90-degree, a perpendicular angle, and squeeze in like that, and that helps create a good seal. The mushy of the mask against the mushy of the face, and you get a good seal. And you can attach your bag, just set it on there, and you see the lungs inflating over here? Adults are 1 every 5 seconds. 1001, 1002, 1003, 1004, 1005. Breathe. Just enough to get chest rise. 1001, 1002, 1003, 1004, 1005. Breathe. So if I don't keep a good perpendicular seal, if I'm angled off this way, I got a leak over here. If I'm angled off this way, I got a leak over here. So technique is key here. That way you don't fatigue yourself. So C, E, okay, and just squeeze the bag as much as you can. Some people have big hands, some people have tiny hands. Whatever you got to do to squeeze this bag, I can say, hey, you, come over here, squeeze this bag. Come on. Okay, just squeeze it when I tell you. And I'll go into a double seal, because a double seal is much better than a single seal. So I'll rotate around here, and I'll grab that mask, and I'll squeeze. I'll do a double seal like that. It's a double CE. Squeeze the bag as much as you can. 1001, 1002, 1003, 1004, 1005. Breathe. 1001, 1002, 1003, 1004, 1005. Breathe. Okay, so this is much easier for people because it's hard with one hand. If you have to chicken wing it, and that's fine. Or sometimes if we're on the ground, oops. If we have a patient, let me come around here. I'm gonna set him on the ground. A lot of times we find the patient on the ground. You know about head tilt, chin lift and all that to open the airway? Head tilt, chin lift. Watch my knees. Got him. Hands free, okay? C, E, like that. Or if you got tiny hands, I don't mean anything bad by it. Some girls just have tiny hands. That's just the way it is, okay? Do you see? And just push it against your leg. Whatever you got to do. Does that make sense? Mm-hmm. Okay. Or chicken wing it, or if you get help, come down here and help me. Whatever. Just extra people. As soon as extra people start showing up, things get a lot easier real fast. Just like that. Do y'all do oral airways? Not really.
No.
Not so much. Okay, I'm gonna stick stuff inside people. So that's the BVM. So you can use it without the tank, but just remember, it's how much percent inspired oxygen. 21, because it's coming straight off of room air. But once you hook it up to this tank, there's no break in the system. It's coming straight out of the tank, through the tube, into the reservoir. You squeeze the bag, it goes into the patient.